Ayurveda is slow. So Manasroga is one among Ashtanga Ayurveda. Though it is not directly said, mental issues, especially depression and anxiety, is growing like anything after incident of corona. So I have treated a condition of early schizophrenia. Definitely, Ayurveda and modern medicines can work together because there was no inspiration initially. But once I joined to Manasroga, I started to find my role model. Myself, Dr.Raviprasad Hegde, Associate Professor and in charge Head Department of Manasroga, that is Ayurveda Psychiatry in the College, Advas Ayurveda Medical College, Modubidri. Ayurveda Psychiatry, I was never knowing anything about it initially. I joined only because it was the new branch in STM College of Ayurveda Udupi. So I was in the Kaya Chikitsa for about 2 months. Then this new branch came. So this is also there in the under Kaya Chikitsa itself. Hence I may get opportunity in future. The planning that I changed the department to the Manasroga. So as I said, there was no inspiration initially. But once I joined to Manasroga, I started to find my role model. So I searched for role model and Dr. P.V. Bandari, one of the renowned psychiatrist in our district, Udupi district. So he was the owner of Baliga Hospital and he does a wonderful job. He does the social activities like de-addictions and awareness about the mental health in the community. So I consider him as the role model. Okay. So Manasroga is one among Ashtanga Ayurveda. Though it is not directly said, we get Graha Chikitsa in Ashtanga Ayurveda. So we can keep all the modern mental disorders under Graha Chikitsa. And how it is different from modern psychiatry is usually psychiatry concentrates on the disease and its management through the drug therapy. That is the motto of the modern psychiatry. But in Ayurveda, Manasroga is there, but we are giving much importance for the prevention of the mental disorders. So through Shastra, whatever said in our Samhita, so like Achara Rasayana or Sadvratta, we are promoting it so that we can prevent so many mental issues. If it is there, then we have to treat with through the purification. In modern psychiatry, they treat according to the symptom of the patient, but we treat the whole body, so that by treating the whole body, the patient gets the clarity of mind so that he can come out of the mental issues. So there is no definite definition for the mental health in Ayurveda, but we consider Sushrutacharya Samadosha Samadhatu Samagni Balakriya Prasanna Atma Indriya Manaha Swastha Ityavidiyate. So the health depends on even mental health also. If there is mentally we are fit, we are healthy. So we treat almost not only mental health, mental issues, we treat all the disorders according to Acharya Charaka's Trivida Chikitsa, Sattva Chikitsa, Daiva Vipashya Chikitsa and Yukti Vipashya Chikitsa, depending on the condition of the patient. Sattva Chikitsa will not work on all conditions and Yukti Vipashya Chikitsa will not work on all the conditions. So the combination of the treatment, even Daiva Vipashya Chikitsa, that is needed. In the modern psychiatry, Daiva Vipashya Chikitsa is never said. So that is the speciality of Ayurveda. Sattva Chikitsa is there as a psychotherapy in modern science, but they consider psychotherapy is something different than the psychiatry. So psychotherapy is done by the psychologist, whereas the drug is administered by the psychiatrist. So, but in Ayurveda, we have to treat a condition through Sattva Chikitsa and also Yukti Vipashya Chikitsa by a single psychiatrist. This is the difference between the modern psychiatry and the Ayurveda psychiatry. Definitely, Ayurveda and modern medicines can work together because we get patients with lot of antipsychotic drugs. We cannot stop those drugs. So we promote the mental health through our treatment along with the modern drugs, so that the patient can come out of the modern drugs easily after taking Ayurveda medicines properly along with the modern medicines. A daily routine, what Charakacharya said, Achara Rasayana. What Charaka said, and also in other Samhita it is there, Sadvrata. If you follow these two, that is enough to maintain your mental health. Reduce our desire, that is the first. to control the mental health. That is said as Naistiki Chikitsa in Ayurveda, Naistikiya Vina Upada. So reduce your desire for the material things. When you are having less desire, definitely you can have a good mental health. Yes, I have treated a condition of early schizophrenia. If the patient comes early, definitely we can give complete relief from the symptom. I had a exam. So many examples are there. I want to give an example of a architect. He has been diagnosed with schizophrenia initially. Then the parents, especially his sister, she was an Ayurveda doctor. She referred the brother to me, and after complete purification methods like Virechana, Basti, and Nasya, for about 1 year we have treated. Now he is completely devoid of any symptoms. Now he is working as an architect, as similar to that of all normal human beings. Misconception is Ayurveda is slow. So according to everybody, they think that Ayurveda is slow. But I agree. So, treatment will take time to act. But even the modern psychiatric drugs, antidepressant, it will act only after 6 weeks. In the similar way, so they also take time to heal the mental issues. But if the patient approaches a Ayurveda psychiatrist initially, definitely we can give the good relief. Ayurveda psychiatry is the need of the present era. So the conditions of mental issues, especially depression and anxiety, is growing like anything after incident of corona. So we have a role in the future. Definitely, if anybody is interested in Manasa Roga, definitely they will be a boost for the mental health. See, Manasa Roga is one of the rare branch. Only 5 colleges are giving the master degree in the Manasaroga, like STM College of Ayurveda Udupi, STM College of Ayurveda Hassan, Kottakkal Ayurveda College, Alvas Ayurveda College, and under Kaya Chikitsa in Banaras Hindu University, one student is getting the thesis on Manasaroga. So Manasaroga is the need of the present era. If any students are interested to join Manas Roga, if they work hard, if they are keen to learn Manas Roga, definitely they will have a better future in the field of Manas Roga. Though you may not get a chance to become a teacher, but as a practitioner, you will become a very good practitioner by learning the mental health issues of a patient, because 80% of the patient are having one or the other mental issues. So if you are able to tackle it, definitely you will be a very good practitioner. Think about it. In future, I think Nimans just came the branch of Manasaroga. Also within next year or next 2 years, KLE is also giving the master degree in the Manasaroga. So there is a future for Manasaroga. All the Ayurveda students think about joining Manasaroga in future. Definitely you will become a very good Ayurveda psychiatrist.